Hi, I'm Ellen Encisco, Research Resident with Cincinnati Children's Hospital, and today we're looking back again at the 2021 Pediatric Surgery Update Course. This time, we're reviewing Dr. Esposito's talk on the indications, techniques, and advantages of ICG use in the OR for pediatric surgery cases. Near-infrared indocyanine green technology, or ICG, can be used for detecting and delineating the anatomy to reduce intraoperative complications. ICG is a soluble molecule that rapidly binds to albumin and is nearly instantaneously taken up by the vasculature and the target organs. ICG is removed from the circulation exclusively by the liver. Because of this, one of the many indications for ICG is gallbladder surgery. Professor Ciro Esposito is the Surgeon-in-Chief and Director of Pediatric Surgery at the University of Naples in Italy. Here's the first case he presented.
12-year-old boy, 70 kilos, with gallbladder stone disease, and at the ultrasonography has several stones in the gallbladder. And he had several episodes of upper right quadrant pain, and we have to decide what to do. Which is the diagnostic workup before surgery or during surgery, and above all, which management is indicated.
If you don't have ICG technology at your hospital, some colleagues use a preoperative cholangio MRI to get a clear understanding of the anatomy.
In the last 3 years, we use ICG technology for complex case in which the anatomy is not clear because you don't know where is exactly the cystic duct, the main biliary tea, you can have the complication. Thanks to ICG, you can have a real biliary mapping during the procedure.
ICG comes in a vial of 25 milligrams per milliliter dilution with 10 milliliters of water. Typically, you need 6 milliliters IV the day before surgery, optimally 12 to 18 hours prior to surgery. With ICG technology, you can see the biliary anatomy very well and you can perform a safer operation.
Now you have a new ICG system because the old ICG system, you have to switch with a pedal and you see the picture in black and white. Now, with the new Rubina system, you have the possibility to remain in color and the biliary tree is colored in green.
The cholecystectomy is the only operation in which you have to inject the ICG in advance. If you use it intraoperatively, you could mainly see the liver since it's taken up by the liver. So then both the liver and the gallbladder would be bright green and it would be difficult to tell the gallbladder apart. You could inject the ICG directly into the gallbladder, but Dr. Esposito and his team don't typically do this.
Elective cases, you bring the patient in the day beforehand to get injected?
Yeah, absolutely.
Let's take a look at the second case Dr. Esposito presented.
27 months old girls of about 10 kilos, a duplex kidney with a non-functioning lower pole secondary to reflux. He has an ureterocele already treated using endoscopy in neonatal period. Now she has a urinary tract infection and urinary incontinence. As for the diagnostic workup and management indicated, there are several options as usual. Using via retroperitoneoscopy, there is the problem because this child has a reflux and it's difficult to remove the last part of the ureter. And via robotics, at the moment, the robots on the market is huge for this kind of children.
In this case, we can use ICG at 3 separate times. First, we can use it to help us identify the ureter and make sure that we save the normal one. Second, we can use the ICG to identify the vascularization of the kidney and the part that we're going to remove. And finally, we can see the kidney after we clip the vessels and inject the ICG intravenously for a third time.
The normal ureter that is green and you can start the dissection. The second aspect, you have to inject intravenously 2 milliliters of ICG solution and you can see the vascularization of the kidney. And in this way, it's easy to isolate the 2 vessels and to save the main hilar vessels because you have to leave a moiety. The third part is that at the end of procedure, after clipping the vessels.
So again, to summarize, in partial nephrectomies, the ICG is needed 3 times. First to see the ureter, then to see the vascularization before we clip vessels, and then to see the vascularization afterwards. And here's the last case Dr. Esposito presented.
The last case is varicocele. 13-year-old boy with a grade 4 varicocele according to Dublin and Amalur classification. and he has an hypotrophic ipsilateral testis, and he has left testis pain. And this is a classic indication for surgery for us. There is no spermiogram available because he's too young to do it. And for this reason, we have to decide which is the workup and the management of these children.
Here, Dr. Esposito is presenting a study that they did in which they showed that after introduction of ICG, you can do an intraoperative fluorescence lymphography. In this way, you can use it to spare the lymphatics.
To perform this procedure, you have to inject intratesticular 2 milliliter of solution, and you can see lymphatics colored in green, and it's extremely easy to spare the lymphatics, and we use this technique for more than 150 patients, and we have 0 hydrocele in postoperative period. Use this technology is absolutely amazing. This is the main indication. For me, cholecystectomy, partial nephrectomy, varicocele are the best indication, but also lymphomas, tumors, to check the vascularization of anastomosis is others indication. You have to develop this.
So in conclusion, ICG is a safe, useful, and versatile technique to adopt in pediatric minimally invasive surgery to achieve a better visualization of surgical anatomy and an easier dissection. ICG fluorescence can help surgeons to reduce complications, and it can be considered in selected cases to increase the safety of laparoscopic procedures.
ICG is definitely something to be paying attention to. This is something that every day we're finding more and more uses. We can probably go through all of us and figure out different cases that we've tried it on: thyroids, thoracic duct leaks, all these different things. So it's really, we're getting more and more. Next year, we'll probably know more.
Thank you for listening. If you like this video, be sure to follow us on social media, subscribe to our YouTube channel, and comment on Apple Podcasts or wherever you're listening. Thank you for listening, and remember, knowledge should be free.